Well, good afternoon, everybody, and welcome to our Doing Business in a Post-Brexit World. I'm joined today with some well-known faces in the industry. I have Damien Bové from Adact Medical. I have Andrej Kuttruf from Evapo. And from Vape Club, we have Dunne Marchant. Welcome, everybody. So today's format is going to be very open. We do request that if you have questions to please send them up. And we've actually got a couple to start us off here. So we're going to have a broad range of questions, I think, everything from regulatory changes, which Damien will be able to help us out with, to how retail is coping, both on an online perspective and in brick and mortar, now that all of the stores are back open after our, second or third lockdown. It's hard to tell these days. And then we have also some very interesting news this week with regards to some NHS trials. So lots of things to talk about today. So the first one I think that we'll kick off with is around about retail. Obviously, the pandemic has had a huge effect on retail. Brick and mortar stores have unfortunately not been classified as essential and have pretty much spent most of the year closed down for the most part. So Andrej, how has retail been affected through the pandemic, and do you think vape shops will survive?
Sorry. Thanks a lot for having me. Yes, I mean, it's been a very strange time clearly for us. The last 12 months being on and off with stores closed and reopening and closing and reopening. And it's been scary at the beginning. I think as time went on, I think we got a bit more used to it. Luckily, as a business, we saw lots of our revenue switch to online. So fortunately, our customers used our website and switched to online. But yeah, as you said, it was unfortunate we didn't classify as essential. I think lots of smokers were evaluating their health during the pandemic and deciding to quit. And I think it would have been vital to have vape shops there to support that journey. I still want to, I think the second part of your question was whether we survive as a as an owner of 38 shops. I naturally take an optimistic view on that. I think what has been proven is just the resilience of our industry. I mean, we had the US crisis hitting us back in 2019. Then we had the pandemic. We were kind of out of business for the last 12 months. And it's something we as an industry can be proud of, how we got through this, and the resilience we've shown and how businesses have adapted is just amazing. And I think we're seeing now where the stores are open again, a bounce back. Customers are coming back, and I think it's a testimony to the help and value we are providing to our customers and to smokers. And I think as a vape shop, it's still such a vital service we are providing, that people come in and we are giving them the guidance, the explanation, the service, and they pop in every week. We have a chat, and it's just a vital service, I think, for smokers who need that human connection. And so I'm confident that this is still continuing, that people need that. Maybe one point just from a statistical view, I mean, we had huge online sales during the last 12 months, but clearly our hardware sales as part of those sales are a much smaller part than what we typically see as part of our store sales. Then maybe can comment on that, but that just shows for people to go and buy a starter kit, they still need that extra level of explanation and guidance. So so I take an optimistic view on that. Yeah.
Absolutely perfect. Dan, from an online perspective, obviously this pandemic probably did your business quite good, did it?
Well, of course, yeah. So I've an interesting look on the obviously the shop closures, because people would tend to assume that as an online retailer it was a wonderful thing, and of course, you know, business did increase significantly over that period of time, but it's not, you know, it's not a permanent situation. And actually, we have to remember that as an industry, as a whole sector, the brick and mortar stores are really at the, you know, the front line of helping a smoker actually make that switch. You know, someone who can go into a shop, who doesn't understand the products, doesn't understand the processes, and wants to talk to a person and to find out, you know, what it is they need to look at purchasing and try different products, etc., etc. And when that's taken away, obviously it is much harder for the smokers to make that switch. And I think, you know, there's a place in the sector for all, you know, for online, for brick and mortar, for all of the different methods of purchase. On to Andre's point, we didn't see a huge differentiation in the number of hardware products versus liquid products. Both seemed to go up equally, but I think that was just a case of, you know, the online maintaining its regular customers. It did, and other people obviously being forced into a situation where they had no option but to buy online. And I hope that we've been able to provide a really good service for the vapers whose local store was not in a position to offer click and collect or customer, you know, local deliveries, etc. You know, and to be able to help, you know, the vast number of vapers who were unable to get products in any other way apart from maybe their local corner shop, which may not have, you know, what they're looking for. And at least help people get through what has been, you know, a very difficult sort of 12, 14 months or whatever we're into now.
Right. And Andrej, you know, touched on a very interesting point there. You know, there's an awful lot of misinformation out there on vaping products. You know, from a valley at, you know, the end of 2019, which was, you know, we thought was a devastating, you know, blow then, and then we went right into the pandemic at the start of 2020. How have your businesses been adapting to that to try and combat some of that misinformation?
Well, Avali had a huge impact, you know, very quickly overnight. And I think most retailers saw a significant dip in sales for a period of time over that. And it was very, very difficult to combat because, you know, the media love bad news, and it, you know, it sells papers, it sells advertising space, etc. I think, you know, everybody was out there trying to put the right comments out, trying to explain that these were not legitimate, you know, vaping products that people were using to stop smoking, that these were, you know, black market THC products, etc. But it was very hard to get that out into the media. We did some myth busting videos on it on the old YouTube channel and tried to, you know, put the correct points across, but, you know, you get very little coverage. And I think it's taken a long time for the message to kind of dissipate. And even when the CDC and the FDA released their statements, you know, confirming what we'd been saying for months and months, it's a real shame to see that that doesn't get the same coverage in the media as the scare stories. And I think we're still fighting that battle now, even, you know, sort of 18 months later.
Andrej, how did your business cope with it? Did you have to, you know, give new advice to your staff as far as how they deal with those type of questions, or was it a little bit easier when you're face to face with a consumer?
Well, I think we probably, as Dan was saying, yeah, I mean, we saw a similar drop in revenue. It was overnight and a huge impact. We put out a lot of communication. So internally, we did training sessions. We put a lot of Q&As out, how to answer certain questions customers may have. I mean, I know we still opened shops at a time, and I know from my interactions with customers or people on the street who kind of say, well, you're killing people. And so there was a lot of backlash and just unfortunately lots of misinformation. And I think we see that in the statistics, that the perception of harm of e-cigarettes versus cigarettes has gone up. So more people are now confused about the relative harm of e-cigarettes versus smoking. And we know that people who are unclear about the relative harm, relation of harm of vaping versus smoking, they are less likely to take up vaping just because of exactly that confusion. So there's still a huge battle. As Dan said, it hasn't quite gone away. It hasn't dissipated. There's still a lot of misinformation out there, and I think we have to keep educating, keep engaging. I think to some extent also what happened is the whole crisis took a bit the fun out of it. I think so. What we've seen is that also the enthusiast side of the market has been impacted, I would say, and to some extent, I think as an industry, we kind of, to be frank, I think we kind of were swimming in our own pond too much. I mean, we've seen these expos, the Birmingham Expo, the London Expo. They were great expos, but they only attracted existing vapors, and I think they only catered to a certain crowd in a way. And I think we now need to adjust as a business. We need to much more try to embrace smokers and really adjust and listen to smokers. How can we reach them? How can we really make sure to take them on that journey? How can we educate them? And so there's a bit of work we have to do as an industry, and a bit of growing up maybe as well. We have to do to reach out, and yeah, events like today and expos and all of that. It should be about how can we reach smokers. Let's help them to quit and show the potential of vaping and all the other alternative nicotine products which get people off cigarettes. So yeah, so I think that's in a way the adjustments we need to take as a business.
Absolutely, and we do have a couple of questions popping up here. How soon do you forecast vaping sales revenue to bounce back pre-COVID levels?
Well, I'll take that question. I think Dan is in a different position, but so I mean I mean, coming out of the first lockdown back in June, we had that trading period up until October where we were allowed to trade, and it did take us roughly, I think in October we were kind of back on levels similar to what we've seen the previous year, so that's been what 3-4 months, which in a way is encouraging that we can bounce back that quickly. Coming now out of the third lockdown, we've seen a really strong start. So it's promising that I think we will see a much quicker ramp up of people who are again feel more comfortable going out, more confident, and have probably also missed our stores. So yeah, I think we're seeing now people coming back much quicker than after the first lockdown.
Absolutely, Damien. From a compliance standpoint, your business does an awful lot of work around toxicology and making sure that products are safe for the market. Have you seen things change with your business and the level of testing that you have to do? With the Valley, and then also too with some of the misinformation around vaping and COVID.
Yeah, so we've seen a few things. When the Evapo came out, we had a lot of customers asking us to produce statements about that these ingredients weren't in their products, and we produced that for a number of customers. And it did highlight there is always an issue where companies are selling products where there's a portion of the formulation they don't know what's in it, because they rely on buying flavor concentrates and blending them. So they'll buy, a whole host of flavor concentrates and blend them to make a product. And some of that information is confidential. So we act as a middleman to make sure that information gets to the regulators. So there's a little bit of where some of the companies don't quite know what's in their product, and they rely on companies such as ours, and to ensure those products are safe, and we do those assessments. And we have a very rigorous process for doing that, as well as, you know, Arcus, the other UKVIA member, very rigorous. We see a lot of work from some of these, I can't like to call them like a chop shop. You know, they do a very cheap, low cost compliance. And we've had to do a lot of repeated work for companies like that, because they, where their notifications being rejected in markets because they don't have a lot of the data. They don't go to the same levels of details that we go to. So whilst it's always very self-serving to say to companies, you need to make sure you invest in getting the compliance project done properly. It's not just about box ticking. So that's, you know, you need to make sure that your product's being fully evaluated. So that's one part of it. And when the EVALI came out, we saw quite a lot of that. During the whole COVID, especially the first and second lockdown, there was a distinct drop-off in the amount of new products coming to the market, new testing and things like that. People were, you know, obviously being very careful with cash, and new product launches were still going on, but not anything like as strongly as we've seen in the past. We've seen a big pickup since the middle of the new year. So the past couple of months, lots of new products coming to market. So you get a real feel that the industry's building some momentum again, and getting products are coming along. But at the same time, there's things going on in Europe with the central poisons registrations that's putting a lot of pressure and scrutiny on some of the zero fill products. It's always a big thing that we've been quite sure of. The zero nicotine products with short fills and the long fills and all the other variants of that, they don't have the same regulatory scrutiny. It's much more reliant on companies to undertake their own internal scrutiny. But now, because there's a central poison registration, some of these products that are getting sold into Europe are starting to have a level of regulatory scrutiny. And as predicted, we've seen a lot of products that are just not fit for market. So it all comes down to the UK vaping industry, extremely safe. The products are very well scrutinized, but you need to buy from what I would call a respectable companies, and that you know are making the investments and taking the times with products. It's like any industry. If you go and buy the cheapest thing you can, then you're not always sure you're going to be getting that same level of scrutiny. And that's why buying from, you know, bricks and mortar businesses that have got a good solid reputations, buying from well-established online businesses, is just add some safety and security to that process that companies need to be aware of. But and there's things in the pipeline that are going to strengthen that, such as I know the MHRA are keen to bring increased quality standards throughout the manufacturing and accountability. So things are going to continue to move to in that base. But I'd say those key things, it's the product scrutiny. The good companies are doing it well, and that's all. That's the take-home message.
That's great, Damien. Appreciate that. And I just want to kind of take a little bit of a tangent here into some really good news that came out yesterday. I'd just like to get the panel's opinion on it. For those of you that don't know, the news came out yesterday that 5 NHS hospitals will now be conducting a trial with the University of East Anglia to give vaping products out in the emergency rooms for free over a period of time. And then they're going to monitor the results over a period of 30 months. How do we think that change in the NHS's stance will have an impact on the business, both in a positive way or a negative way?
I think it's fantastic to see the NHS really lead in with, again, more sort of evidence-based, science-based policy that, you know, this is the most effective way to take a smoker out of smoking. But it's a great trial. It will be really interesting to see how it evolves, because one of the things I think a lot of people within the association have been discussing is, what is the product that they're going to get? What type of device? Because, you know, the reason that there's so many hundreds or thousands of different products on the market isn't just pure consumerism. It's because one device will not, one setup will not work for every smoker. And a lot of people have to try out different devices to find what will work for them, what will help satisfy their cravings, even down to different flavors, different nicotine types, different nicotine strengths. And of course, it's fantastic to be encouraged by the NHS to try vaping, but there also needs to be a little bit of follow-up to see, you know, did that device work for you? What about it that, you know, you did like, what you didn't like? Perhaps there's another, you know, product that could work well for you. The sort of things that people in vape retail do on a daily basis, you know, and will help that that customer or you know, that smoker through their journey. And it will be interesting to see how this scheme evolves to you know, how they'll be able to fill that gap, you know, and encourage the people who are just trying it out to, you know, if this one doesn't work for you, there are loads of other options, but, you know, it's just a starting point, you know.
Andrej, as a brick and mortar retailer, how do you feel about it?
Well, as Dan said, it's fascinating news. It's just amazing. It reminds me a bit of 2019 when we had the first vape shops in hospitals. It's just a huge acknowledgement from the health community about the health potential vaping has, and we know every day 200 smokers die from smoking related diseases. It's like an airplane crash every day. We kind of got all spooked about COVID deaths, but the real tragic is still happening day in, day out with deaths related from smoking. So so much has to happen to get smokers off cigarettes, communicate about the health risks of smoking, and the solutions are there. We have vaping products, we have nicotine pouches, we have all kinds of different less harmful alternatives nowadays in the market, where smokers can switch to as a far less harmful alternative. So I think it's great to see the NHS getting behind that, the AE trial. I mean, as Dan said, yes, there will be more needed in terms of education, and I think it's also, again, down a bit to us as an industry to engage with the health community and bring out that needed level of education. We engage in some councils with local stop smoking clinics, and we hold workshops with clinics to basically educate them how to use e-cigarettes as part of a quitting journey for a smoker. So as an industry, maybe one further point on that, as an industry, we are quite handicapped that we can't speak about the health benefits really. All we can do is refer to the Public Health England study that vaping is 95% less harmful than smoking, but we can't make any health claims on the behalf of our products. We can't say, well, it helps you to quit smoking. We all know it does, but we can't say it, and hence it's so vital now with the UKVIA and in the blueprint regarding the consultation on TPD3 that we asked, please give us pre-approved health claims which we can make. So as an industry, we are very dependent on news like yesterday to show people, look, the credibility is there behind the product. So yeah, hopefully we'll see more of that, and hopefully we can amplify those kind of news.
Well, this subject is definitely getting lots of questions. The easiest and the quickest one here would be, might the NHS adopting vaping lead to the development of a pharmaceutical vape product? What do we feel on that one?
Well, the only difference there's a difference between the pharmaceutical and a consumer vape product is very minimal from the ones I've reviewed. The devices they use are, because I'm involved in a few medical development programs, devices they use are very simple because they have to be very reproducible. but they operate in the same way. The products are very similar. The vape products themselves are, again, they're a simpler product. The flavors are much reduced, not because there's any issue with the flavorings used. It's just there's a bigger burden of to establish safety, so it's easier to have fewer ingredients. It's kind of a practical sense. But that is fundamentally the difference between a pharmaceutical vape product and a good quality consumer product. There's obviously a load of documentation in the background, but fundamentally the products are the same. The only benefit is that obviously it goes through a whole ream of evaluation to say it's delivering the nicotine at the right concentrations to satisfy people's cravings and things like that. But the fundamentally the same thing. It just all it was achieved is it adds a layer of additional credibility onto the industry. So when people, it always concerns when people get stuck on this thing about a pharmaceutical product. It's just a different pathway to the same market, and the products are not vastly different.
Yeah, I probably can echo Damien's views. I've mixed views, but it's already so far less harmful, and there are so many studies already showing that existing vaping products serve smokers' needs, and the medical pathway is, I guess, is quite challenging. It takes many years. It takes huge amounts of investment. It's probably not really available for anyone but the biggest companies. And in the end, there will be a product which is kind of already 3 years behind the products on the consumer market. So I'm not sure if in a way a pharmaceutical product is the answer. I think, like I said, we need to be able to make more health claims based on the science and the studies which is already there. We just can't really connect it with any products. We need more clinical trials. We need more data. And hopefully we need a more positive regulatory environment to support that and get the message out that vaping is 95% less harmful than smoking.
And I think that's one of the things that these kind of studies bring the discussion back to. Vaping is an alternative to smoking, and that sometimes gets lost. People don't vape just for the sake of vaping. They're vaping because it's a comparatively better way of consuming nicotine, and there will always be a percentage of the population that want to consume nicotine, and that should be the discussion. It's that, not is vaping safe, and that's one thing. I mean, we're happy that it is very safe. The real discussion is it's so much safer than the alternative of smoking a cigarette. And it's good to see that. So these kind of studies refocus that concentration around, but actually this is much, as a comparison to smoking, this is streets ahead.
Yeah, I think to go back to a couple of the points that we made, Andrej, you spoke earlier on about, ensuring that we have a constant flow of real, robust, positive information, and as we know, we've just come out, or we're just about to finish our Vapouround campaign. I think my cat's got a comment on what's going on.
Try not to kick the cat on live broadcast.
Where was I going? Oh yeah, so we're just coming out of our Vapouround campaign for the 4th year, which I think is a really good way of putting a positive message about vaping out there. Do we think that this switch by the NHS will only go to help switchers who are maybe on the fence about taking that plunge into doing something better because of their misconception about the dangers of vaping? Do you think that this will just add to that positive message?
I'm sure it will add a lot of credibility, yeah. And some smokers will be surprised if they are ending up in hospital and suddenly the doctor is recommending them to switch to vaping, because at the moment they probably don't know that the health community is behind vaping and supportive of vaping. So I think it's very positive. I mean, one thing we haven't mentioned, but it's something we know as an industry, that e-cigarettes are twice as effective as any other NRT product in helping smokers to quit. So it's just logical that a GP, instead of recommending an NRT product, would rather recommend a smoker to switch to vaping. The beauty of a vaping product is it has started as a consumer product. It has people can quit smoking with it, but people can also keep on vaping. And that's so the real power of e-cigarettes is that it addresses the behavioral dependence of a smoker. It's that habit. It addresses the nicotine habit, but it also increases the compliance and adoption of it, because ultimately people also enjoy it. I think it's great to see that the health community is getting behind that. So more of that.
Yeah, I have to agree. I think for the vast majority of people, and in this country, like we have a huge love for the NHS, and we have a massive respect for the people that work in it, as has been seen over the last year or so. But it's very common that the good news or the positive messages you get about vaping come from within the vaping industry. And you can understand that a smoker may take that with a pinch of salt, because, they're thinking, are they just trying to sell products, etc. So when the message is actually coming from your doctor or your nurse or your GP, it comes with a lot more trust than if I say it, basically. And I think that can really help a lot of smokers who have been bombarded with all the misinformation about vaping over the last 4 or 5 years, start to change their focus and shift their perception of the products and what it is that vaping really does, to its, the full harm reduction benefit. And it could be a massively productive scheme, particularly for this, the Smoke 3 2030 target, which we're wildly off course and we're not going to hit.
We've got one question in here, and I think I'll be able to answer this one. Is the panel as a collective proud of the state of the vaping industry in the UK in comparison to our counterparts in the US and the EU? I'll kind of start off on that. As an association, we hold regular calls with associations around the world to share best practice and to understand what's happening in each country and how collectively we can combat that. And we had a call only this week. We're seen really as the beacon of hope for the industry around the world. And I think that's why the UKVIA as an association and all of our members are really so focused on standards and on the quality of our products, and really ensuring that we protect that positive vaping message in our public health, with our politicians, and within our own stores and our businesses, making sure that we're doing things the right way and the way society wants us to do it. So I think, from my perspective, although sometimes it seems tough in the UK compared to what other countries have to deal with, we're really getting off quite lightly, I think. Any other comments on that from the panel?
I fully agree.
Yeah. I think we benefit from a rational approach to the regulation that don't necessarily get in other markets. We've seen this with flavour bans being brought up in markets, which the science has demonstrated are counterproductive, and from a public health perspective, they get caught up in the bans on youth vaping, which we know doesn't really exist. It's youth smoking that's been the big issue, and vaping's just eliminated that to a large extent. And if vaping wasn't there, there'd be an epidemic of youth smoking, and all these kind of things. And politicians and regulators try to score cheap points by going for what appears like save the children, save the kids from this, and it's cheap point scoring, and you see it across many markets. And we're fortunate in the UK that we have a sensible narrative with the regulators on these products, and that makes me proud, as well as how the industry operates within that framework. But you know, and I think we have a responsibility to kind of speak up on behalf of these other markets where they're having to deal with these ridiculous situations. And I know the UKVIA does help a lot with tackling these things around Europe as well. So it's good to see.
Well,
yeah, I agree. I mean, the industry can be broad, but certainly the UK can be broad. I mean, we're really leading the world. I think we have the highest penetration of vaping among all smokers, and we have the fastest decline of smoking rates in Europe, and that's down to a very sensible approach and regulations, and really seeing vaping as part of the solution. Yeah, so I think we can be very proud in this country of that.
Absolutely. And I'm going to try and roll in, we're getting on in time here. There's a couple of questions with regards to the APPG and the World Health Organization, but also too about our TPD, our TRPR review, and our guidance for that. So I'm going to try and roll both of those together. So, you know, we saw the headlines this week where politicians in the UK have called for reduced funding to the WHO if they basically continue on down the path of having a negative outlook on vaping products. And as the UK is one of the largest funders of that organization, do we think that will have an impact? And then I'd also like to talk a little bit about, you know, we highlighted the smoke-free 2030. You know, do we think that's really achievable if we don't embrace e-cigarettes as being a fundamental part of that solution? So let's hit both of those, and then we'll talk a little bit about the blueprint that we've come up with for regulatory changes for a positive outcome in the TRPR review. So let's hit the first two of those, and then we'll go to the TRPR.
Well, yeah, to jump in, I think it's fantastic what Mark Palsy and the APPG have put across to the WHO on the back of their their recommendation that countries ban open vaping systems. And, you know, the work of the APPG has been fantastic for many years. But I think, you know, is this a proportionate way to tackle the WHO? I think yes, because one, you know, money does talk, but it's the first time it's been brought up into open discussion as to actually take the WHO to task about their stance on vaping products. And I think it is ridiculous for the WHO to talk about banning a product that we know, you know, is multitudes safer than combustible tobacco, whilst not talking about, you know, the same for combustible tobacco. Now, I wouldn't encourage a ban at all on combustible tobacco. I don't think it's right to encroach on people's freedoms to choose. But at the same time, it is absolutely ludicrous to encroach on people's freedoms to choose what type of vaping system that they use. And allow people that freedom of choice as to make that decision themselves, when the alternative that's still available on the market is far, far more harmful. And that conversation and that debate needs to be had with the WHO. And I think it's absolutely right and correct that you know, our government, who are world, you know, leaders in tobacco control, fortunately for us, are now making that point and taking a stance against it. I think it's good.
I mean, the key point of the WHO's issue with open systems is they're open to adulteration. And it was just such a nonsensical stance to take. I mean, a loaf of bread's open to adulteration, you know, but they're not calling for the banning of a loaf. You know, I know it's a ridiculous comparison, but it, you know, the position just seemed to be just plucked out of thin air and plonked into the document, and it just there was no evidential build up to it. It was just like, we'll just stick that in.
Yeah, cigarette is equally open to adulteration.
I think the WHO, when India banned vaping, the WHO was applauding India for that on their Twitter account, which is, it's just disgraceful. 1 million people die in India from smoking, and WHO has nothing better to do than to applaud on a vaping ban. So it's just completely out of step with science, and Mark Pawsey is spot on with asking, can we review that support for an organization which is whoever is dominating that, but lobbying, backroom work, whatever, but it's not guided by science. So it's, spot on.
Okay, we've got about 10 minutes left. So I wanted to really kind of move on to the Tobacco Regulation Products Directive changes or review here in the UK. And obviously post-Brexit, we've now moved away from reliance on having to follow any new changes to the TPD, which is also under review. Now, the UKVIA has spent several months, and I know many of those on the panel here have been directly involved in formulating our blueprint for a better vaping future, which we submitted into the review for the TRPR. How do we think that that these recommendations will be looked at and I think potentially adopted by the UK, and how do you think that any potential changes might affect how we do business with the EU?
I think it's good that we can split from some of the regulation in the European, the TPD regulation. The regulations took such a long time to go from consultation to inception that by the time they came out, they were more or less out of date on a number of fronts. And we saw that with the unregulated products that were just outside of the regulation, such as the nicotine-free short fills and things like that. And by being outside of that big bureaucratic machine, which is totally necessary for such a large marketplace, with so many different governments in it, but it moves slowly. It's just the fundamental nature of it. So I think we're well placed to continue the trend of having sensible regulation in the UK, and be able to respond more quickly to the realities of the marketplace and what these products are doing. So I think that's a great thing, and I think there's an appetite within the MHRA and some of the other and Secretary of State for Health to have a more sustainable and a sensible approach to the regulation. So I think that's great. It will obviously, a lot of the companies in the UK based do trade products into Europe, and you will end up with 2 tiers of products if the regulations diverge significantly. But I don't think that's the core product itself will be the same. Flavors are unlikely to change. It'll just be how they're packaged fundamentally. So I don't think it'll be problematic for industry. I think they'll be able to cope with that quite easily.
Yeah, I fully agree. I think the opportunity for us to sort of continue with a real evidence-based regulatory system and remove a lot of the sort of very arbitrary, nonsensical rules that came in with TPD2. For example, the tank size limitations, the bottle size limitations, etc. Things that literally did nothing to enhance or protect people's health. Really what they did is they made it more of a faff for the consumer, making smoking, much more hassle, making vaping much more hassle than smoking. You don't just pull out a cigarette and light it, you've got to fill up your tank and carry spare liquid and carry spare gauze. There is more difficult anyway. And to be able to remove some of those barriers and take away some of the silly, extra hassles of, I've got to fill up my tank 6 times a day because I can only put 2 mils in it or what have you, etc. It's going to help the consumer massively as well. And of course, you know, we're in a situation where there's other countries outside of the EU across the world that are looking at the UK now as a world leader in vaping regulation, and it's given us an opportunity to really influence outside of the EU now as well. You know, we've seen it in Canada and New Zealand, etc., taking a much more science-based approach, and hopefully we can sort of start catalyzing that across the world if we really, you know, look at the review here from a scientific point of view and make the regulations fit for purpose.
Yeah, I think our political views on Brexit aside, I think it's a real opportunity now to chart our own path, and I think the UKVIA has put together a very succinct, comprehensive blueprint. A lot of thought has gone into it, and I think Damien picked up a few of those points we are suggesting in terms of increasing bottle size, which can reduce the plastic wastage massively, increasing the tank size, getting short fills tested and regulated. Damien's mentioned that earlier, being able to make health claims. Lots of those points. I think it's just now a good time to review what has been done a bit voluntary, on a whim in the first set of regulations, and now this can be amended and hopefully set us up well for the future.
Absolutely agree. Well, I think we're just about out of time, unfortunately. We could probably go on for another hour on this subject. But if you do want to, you know, find out more information about what's happening, if you go to the UKVIA's website, we do have all of our documents on there that you can review. Or if you'd like to go to the UKVIA stand, I'll be on there for a little while yet, and glad to answer some of the questions that unfortunately we didn't have time to get to today. But to my panel, thank you very much for joining us today. I hope we were able to answer quite a few questions, and let's hope for a very bright future moving forward. Let's hope we don't have another lockdown, and our businesses can get back to normal. Well, thank you everybody, and have a great day.
Thanks a lot.